Nancy Donbavand considers herself a lucky woman. She has a beautiful family who loves her, and a son whose concern for her health may well have saved her life. Nancy was a longtime smoker who quit several years ago, but smoking was an enjoyable habit for her.
I mean, it really was. If I could smoke, I would continue to smoke. And it's very hard to quit.
Nancy's son, who is in the medical field, knew his mother met the National Comprehensive Cancer Network guidelines for screening. He encouraged her to get tested. For people ages 55 to 74 with a 30-year history of smoking, experts recommend a low-dose CT scan.
Take a deep breath in and hold it.
It's a painless, quick, inexpensive test that gives doctors a detailed look inside the lungs.
And breathe.
Nancy was surprised at how easy it was.
You just lay down, your arms are up because they're doing your lungs, and the machine goes over you really quickly, painless.
It's an uncomfortable conversation to have with somebody to get them to do this, but I knew it was important and it was something that needed to be done.
If a picture is worth 1,000 words, these images spoke volumes.
This is the primary site of her cancer.
Nancy had a tumor the size of a large grape hiding in her right lung. Though it wasn't producing any symptoms yet, it was there, and it was growing. A 20-second scan was all it took to reveal the danger. The experts at the South Texas Lung Institute sprang into action. Baptist Health System is part of a multidisciplinary team of experts in the field of lung cancer. Specialists ranging from radiologists to oncologists to pathologists, pulmonologists, and surgeons collaborate on each case, coming up with the best care plan possible. It's a personalized approach to treating an aggressive health threat.
So you get lots of different perspectives. There's a team approach to taking care of patients. It's not a physician working in a vacuum.
Sometimes patients need chemotherapy or radiation. Sometimes they need surgery. At St. Luke's Baptist Hospital, specialists use state-of-the-art techniques to remove the cancer in a minimally invasive way. Dr. Daniel Diarmond performed what's called VATS, Video-Assisted Thoracoscopic Surgery, on Nancy. Using a camera and special instruments, the surgeon operates through several small incisions. The technique is precise and limits tissue damage. The doctor doesn't have to spread the ribs or cut through major muscles of the chest wall. Dr. Diarmond removed the lower lobe of Nancy's right lung.
We don't see the structures that we're operating on with the naked eye. We see everything using a scope.
Numerous studies show the benefits of operating.
Surgery for lung cancer is the best way to assure long-term survival.
And that's just for your follow-up from your surgery.
An important member of the South Texas Lung Institute team is the nurse navigator, a specially trained healthcare professional who guides lung cancer patients from diagnosis through treatment and survivorship.
And this is a good resource book,
helping them every step of the way. Since lung cancers are often caught at a late stage, long-term survival tends to be poor. In Nancy's case, early detection is giving her a great chance at a longer, healthier life.
It was a really great save in my mind.
He said that the prognosis is very good because it was small enough, it was contained. He didn't see any other spread of it in my body. So it's just a matter of following up and making sure.
Take some deep breaths. I think most often patients come to the clinic expecting that you're going to tell them there's nothing you can do for them and they have 6 months to live. And it's very satisfying to turn that around. People come in without hope and they leave with hope.
If you caught it early enough, it could save your life.
I think it's a great program. I mean, early detection is key.
Important cancer screening, diagnosis, and treatment with the unique and innovative South Texas Lung Institute. That's the difference. That's Baptist Care. For more information, log on to baptisthealthsystem.com/lung or call 210-297-LUNG. That's 297-5864. For the Baptist Health News Network, I'm Wendy Rigby.